there. All right, let's get some analysis now. Angelo Fick, Research Director, ASRI, and Professor Somadoda Fikeni join us. Angelo, let me start with you. He was certainly sympathetic there, saying that the burden has been most severe for those least able to bear it. Do you think this addressed the main concerns of South Africans?
I think it demonstrated the president's commitment that this should be seen as a national effort. But I think for millions of poor people, the questions that will arise over the next few weeks as we go to level 3, and as the president indicated, there is a spike in cases and an increase in numbers. What we're likely to see is that the burden of caring for the sick and of grieving for the dead will become something that is going to be skewed. And there, I think all South Africans will need to prepare themselves for the kind of work that will be needed to continue to build a new social compact in the wake of this disaster and through this disaster.
Were you surprised, Angelo, that the Western Cape also being moved to level 3, given the infection rate there?
It surprised me somewhat, but that is all going to depend on what the various ministers tell us the regulations are going to be in detail for level 3. And that, I think, is going to determine exactly what it is that happens here. What's also going to be crucial is, as the president pointed out, how South Africans respond to level 3. Because caution will still have to be advised, as various physicians from the emergency rooms of New York have pointed out, that we don't know enough about the disease's impact on the body at this point to be confident that it doesn't spread as easily or with the virulence that we have seen so far, and that we are nowhere near a vaccine or any kind of health intervention that makes us or should give us confidence to believe that this is going to disappear and we'll get into September feeling just fine.
Somadoda, do you think he really got the tone right to explain to people that this was about flattening the curve, delaying the huge influx of cases into hospitals, and now we're ready to open up the economy, even though we will see the infection rate continue to rise?
I do think that this continues from the messaging we've heard from him as well as his ministers that South Africa has not reached its peak. However, the lockdown and the stringent measures were mainly to prepare the country for the upswing of these numbers. So to that extent, I think he was simply reinforcing the message that has been coming from him and his colleagues in the cabinet before.
On the economy, I mean, the Western Cape must be breathing a huge sigh of relief, Somadoda.
Certainly a huge sigh of relief in the first place that it was said initially or implied that provinces which have not complied or which still had hotspots would remain at level 4. I'm sure that one was going to be politically and economically and socially untenable in a sense, because there are huge areas which are not yet affected or which have actually conducted themselves well. That they are talking about a targeted approach in the concentrated areas may not only make sense in a way of trying to impose restrictions in those hotspots, but also can concentrate resources in those hotspots.
Angelo, your comment on that, maybe a political battle that would have ensued had the Western Cape been treated differently, has been avoided with this differentiated approach around healthcare now in the hotspots.
I think that addresses some of the issues. What we're likely to see also is a dynamic response. And I suspect that the 2-week period that is being given at the moment for possibly revising levels might have to shift for those hotspots. And it's not just the Western Cape. It's all of those metros in which the economic activity is concentrated and therefore in which movement of people on a daily basis is concentrated and contacts between people are heightened. So places like the Northern Cape, which are sparsely populated and don't have those kinds of interactions across spaces because of public transportation, are not likely to see the kinds of issues we will see in places like Gauteng and in places like the city centre of the Western Cape. The issues in the Eastern Cape are, of course, slightly different, and that will have to be addressed based on the administrative response of the provincial authorities. But I think, it's one thing to think of these as positive developments, and it's another to go 2 weeks from now, on the 14th of June, when those first numbers come out, to see how it is that these responses have worked or not worked, and what will be required. Because this is not just a government effort. This will require the responsiveness and responsibility of all 58 million people in the country, and particularly those of us who live in cities.
Talking about that, saying sometimes the simplest measures are the most effective, like washing your hands. All right, let's get to the contentious issues. Somadoda, we were speaking before, and you said it would create tension if government opened up either alcohol or cigarettes, one and not the other. So we now have confirmation alcohol will be open for sale, but not cigarettes. Just explain what problems you think that creates for government.
Well, I do think that the biggest debate is going to be to say, how do you arrive at a determination that alcohol would actually be more dangerous in terms of these COVID-19 conditions than, the tobacco would be more dangerous than the alcohol. Whilst it might be easy to explain in a sense that the other one affects your respiratory organs, but at the same time, others were arguing earlier when they were arguing for the alcohol to be banned, to say that once people start drinking, you have accidents and you also have domestic violence, which will land people in the same emergency rooms and intensive care units, which are most needed. So this will be highly contentious and highly debated issue, because you saw the lobby for the opening of tobacco was quite strong, and it had political undertones as well.
So we know by Wednesday government has to produce some minutes or some understanding around those National Command Council meetings that originally banned cigarette smoking. So Somadoda, you expect even more legal challenges. I mean, that's just one group of tobacco manufacturers. We still have British American tobacco and the smokers themselves who may get involved. What do you expect?
Well, I do think that once minutes and all other debates behind the decisions made are made available, some people might be trying to see if certain ministers are associated with certain positions, as some were actually thinking that this might have been a strong push from Nkosazana Dlamini Zuma to have tobacco, banned for the moment. So once that is revealed, you are likely to have even more political undertones, more interpretation of what is happening, and more insinuations as to who benefits from the tobacco industry and who may benefit from the illicit tobacco trading.
Angelo, is this going to become the political hot potato of the COVID-19 era? Cigarettes?
Tragically, I think there is so much attention being paid to alcohol and cigarettes in contemporary South Africa during a crisis in which there are people actually going without food, in which there are real crises around femicide, the endangerment of children who don't get their food from the traditional sources. Questions about education seem to have become secondary in this crisis. And that, I think, is a real tragedy, because it tells us something about the political economy of public debate in South Africa. I think it is important to focus on the essential issues that need to be dealt with, which is what happens to final year students in school, whether it's primary or high school, those students who are sitting in universities in final year fields that we're going to need in future in the health sciences, among others, and how that's going to be managed. And those are, for me, emergency positive crises issues that we need to deal with as a matter of urgency. To me, this kind of concern with whether it's illicit or licit alcohol and tobacco trading is an analogy to a time in which you're discussing whether something that is inherently bad is, sanctioned by law or not sanctioned by law. I think that is a distraction for those of us who wish to focus on how this society is about to face, even though it's moving to level 3 in the lockdown, huge issues of social cohesion, of psychological trauma, and of social division within communities as the numbers of ill increase and as the number of people who die of this disease increase.
So I agree with you. And then let's look at the school reopening. I mean, that was something that he spoke about more than I had expected. Do you think they're addressing some of the concerns? This is so difficult. How do you please everybody? Some parents are dying to send their kids back to school. Some are very, very fearful. This was a very hard balancing act.
And in a country of great inequality, there is great inequality in the education sector, and not just at the level of delivery of the quality of education or the classrooms, but in what is going to be provided. So if you send your child to a suburban school, chances are that it's going to be much easier to do the kind of social distancing in a suburban school because of lower numbers of pupils per class. But for the majority of people in this country who send their children to schools in the lower quintiles, this is not going to be the case. And so it's much harder for somebody who has 48 children in a class or 34 children in a class to have social distance practiced. For teachers who will not have been able to do the kind of policing that they will now require to do on the playground, the kind of enforcement of social distance throughout the school day becomes more difficult. And anybody who's ever been around 5- and 6-year-olds know that this is an almost impossible task. This is why when you send your child to preschool, they come back with measles. They become immune to measles because they've been in contact with other children. And so this, I think, is going to be one of the biggest challenges. And it's going to be easy to blame the minister and the education officials. But some creative solutions will have to be found because those children do not live in isolated spaces. They live in homes with elderly people who are at risk, which is why the president, I think, indicated that no parent will be forced to send their child to school should they feel it's, not a safe thing to do.
Somadoda, are you sympathetic? I don't think any country in the world has got this right. What do you do with school kids who don't always understand social distancing?
Well, as Angelo is saying, it's going to be one of the most difficult things because we are entering into uncharted terrains. What I think ought to be happening is that social partnership between government, private sector, civil society, and many other people within the community, because government alone will not get this one right. Just like, the teachers or the schools themselves will not be able to manage all this. It will have to be that partnership where parents and the school work together. But it is quite inevitable that some of the schools, due to the inequalities, will not be able to provide and be able to provide for the social distancing, as Angel was saying, in a manner that begin to prevent the spread of, COVID-19.
Yeah, so reaffirming what the Education Minister said earlier, grade 7 and 12 learners will go back on the 1st of June. But like you said, no parent forced to send their child to school. Angela, let me come back to you. And you said you didn't want to focus on cigarettes. You feel that this is a side issue that's become very important. But I think for some people it has highlighted possibly the factionalism that remains in the ANC, possibly the real power of the president. We've seen the ANC talk about this and the presidency itself saying that Minister Nkosazana Dlamini Zuma should not be singled out. There are collective decisions going on. Do you think it was unfair that she was singled out around the cigarette ban, for example?
I don't think she was singled out to the extent where I feel sorry for her. Any overpaid minister in this government, I don't feel sorry for. This is what we pay them tax to deal with, the stresses of a very conflict-ridden environment. What struck me was what it revealed about the levels to which South Africans were willing to sort of, go in order to get their way. That if this was an argument 15 years ago or 20 years ago, then I could understand what the contentions were. But this is not an argument about whether or not this is simply a decision made in a vacuum. This is a decision being made inside a very complex and unfolding global health emergency. Yes, there are grave concerns around authoritarianism in government, about which, sort of lobby groups, government officials seem to be accountable to and for, and that's not new in South Africa. But there is a way in which that can be addressed without resorting to the kind of conspiracy theory spinning or the kind of really deeply sexist and really deeply racist kinds of tropes that have been invoked by people in their responses to this. And one began to see, particularly among a certain class of intelligentsia, an intolerance for the idea that you could have the kinds of differences of opinion and view in cabinet, and that it didn't have to be the kind of ugly stereotyping of people as being gangsters or as being in pay to gangsters. We have come from a situation where it is explicable why that would be people's explanations, why they would go to that idea that the state is captured. But the sort of counter-argument is that the legitimate tobacco trading lobby is itself deeply problematic. And we should also begin to look to the political economy of media organizations that have reported on this. What is their shareholder structure? Where are they getting this information from? The kinds of reports that one has seen in public media, particularly around this issue, has been really worrying, because they become exercises that one would use in a high school class to talk about rhetoric, ideology, placement, the words that are chosen, which authorities are put first. And this kind of reduction of complex political issues to heroes and villains has really been of concern to me. Yeah. So far from really being concerned about whether or not cigarettes can be sold or not, my concern is much more about how the responses have revealed, because that cigarette issue will be sorted out between government and the judiciary and the tobacco lobby. Yeah. What I see among ordinary South Africans is a kind of ugly tone difference that I find deeply distressing, because it speaks to divisions in the social fabric and in the body politic.
Somadoda, do you want to comment on that?
Well, what this is revealing is one thing, and one thing only for me, is that irrespective of the smaller proportion of what tobacco and alcohol constitute in the GDP, they seem to have had a far more active lobbying power in our political space, such that they seem to have an overbearing influence. And the second one is the neglect over the socio-economic issues, which are quite fundamental, which have been exposed and amplified by this particular lockdown. And that is where we ought to be exercising a lot of our own effort. But again, a crisis of this nature quickly exposes the kind of fragmentation, the divisions, the fault lines in our society, whether they are political or socioeconomic or racial, because the discourse, as you see now, is precisely about that.
Yeah. Well, I mean, it raises issues, the opposition pushing this idea of a nanny state and questioning the authority of the National Command Council. So Somadoda, do you believe the president is dealing with those, with that rhetoric around the National Command Council?
Well, I do think that he, in his messages, is implying that there is science behind this and the decision-making. And he did talk about accountability in his previous address. But at the same time, I don't think that will necessarily pacify the politics behind what some of the issues are being raised. Because closer to local government elections, let's face it, political parties are beginning to worry as they knock at the doors trying to fundraise, and they are being told that for as long as our business is closed, we have nothing to offer you. And some receiving pressure to say, we have not heard your voice defending our industry. That's where we must begin to get around this relationship, which is very often insidious between business and politics in terms of party funding, in terms of funding of individuals, because now we might actually be seeing some proxy battles on behalf of some of these business lobbies.
That's interesting analysis, and I want to speak to you both about whether government is handling sort of the health concerns versus the economic concerns well. But you raised something there, Somadoda, that he stressed that government is getting advice from scientists. And Angela, what do you think about that? I mean, this comes in the wake of the public spat, you could say, between Dr. Glenda Gray, who was very critical of government's decision-making processes, responded to vehemently by the health minister himself, step by step, and the president saying we're getting advice from the best scientific bodies in the country, the Ministerial Advisory Committee. Do you think that was a real focus given the debates that have gone around in the last few weeks?
I think it was inevitable that the president would have to address this issue. I found it interesting that it came right at the head of the speech, that he outlined that there are going to be differences, as those of us who've worked in universities will know, that even in faculties of science, there are great debates and arguments, and the way in which people understand science outside of the field of scientific endeavor and inquiry and research is, I think, part of the problem. It doesn't surprise me that this has become yet another hero and villain approach to life. I don't think that there are heroes and villains in this case. I think there are misunderstandings of the distinction between scientific advice and public administration and the relationship between them. And there's also been, I think, misconstruction and hyperbole about what exactly it is that scientific advice means. Dr. Glenda Gray herself, in fact, on that mid-April highly technical briefing to the public, indicated that, one of the concerns around emergency room admissions was to lower alcohol consumption. Now, that's an advice moment. How that gets implemented as public policy is, of course, what the NCC, cabinet and government itself decides. And that, I think, has been part of the problem. It may be that scientists may feel, or some scientists may feel, that they have not been consulted enough after the implementation about the effectiveness of this. But there are also, within these spaces, compacts that one forms about where you speak out against things and under what circumstances. And then I think the Department of Health's, the official ministerial response has been to rebut some of the allegations contained in the media reports of what Dr. Gray told people. As for the DG's action, that's a different issue that has to be dealt with, I think, because in a crisis, you don't start firing people and divesting them of the authority positions that they've earned in their career. You thrash out your differences with them in meetings, and in a crisis of this kind, you stand together, as the president is urging, as the Minister of Health is urging, and as I believe many of the scientists on the MAC are themselves urging.
So something he addressed, because we are all health experts now. Thank you so much. And Angelo Fik, please remain with us. Somadoda Fikeni, please remain with us. We'll chat to you a little bit more at the top of the hour. Let's just take a short break for now. Stay with us on The Full View on SABC News.